Well, it's 5 o'clock here, so we were just eating some dinner. So I had Chipotle, but now I'm having some Gatorade to wash it down. I drink these like every day, which I know is problematic, but I need my electrolytes.
You've got to get your electrolytes. All right, Caroline, what do you have?
I have the classic pimento cheese and crackers. So
Ooh, good choice.
good Southern choice.
All right, well, I went, and some people already saw this, with kombucha, strawberry basil,
Good call.
and I had to go with me and Hopi's favorite, gluten-free pretzels.
Yep, they're the best.
So y'all, we just wanted to do this live to kind of go over what's going on. We know that with Team Gilby and with Warriors for Hope, y'all have just been so awesome with supporting these two little superheroes with what's been going on the past month with the FDA and Elamipretide and the denial of their medication that they both take. And so we thought it'd be good to come on and kind of give everybody an update of what's going on, and kind of share Hope and Gilbert's stories, just so you can hear it from two moms from who, it really impacts us all, and the family is the same, but they do have two totally, completely different stories. And we want everybody to know those stories, so that some of the people for who you're fighting for and who you're walking in the fight with to get Elamipretide approved. So, Madison, I would love for you and Gilbert to go first and just tell us a little bit about, who you are. They're our new best pals from Colorado, even though we've never met before. This is like our virtual pen pals, I guess, in modern day life. And so tell us just, about you guys, and tell us about Gilbert's story and how y'all got to where you are at this moment.
Yeah, so Gilbert is our third child. He is 6 months old. He's a Christmas Eve baby, so he was born in December of last year. We have two girls. We have a 7-year-old and a 3-year-old. And then we were really surprised to find out Gilbert was a boy. We were like, oh, we're just going to have all girls. And the midwives I was working with were kind of concerned because I had an older brother who I never met because he was older than me before my time. He died at 11 months old of heart failure. And so the midwives were a little bit concerned because they thought maybe it could be something that would run in the family. So they referred me to a geneticist, but the type of heart failure that my brother had, the geneticist didn't think it was something that would be passed on. He felt like it was probably just a random thing, and that I would be fine. So they just suggested, why don't you just get some fetal echocardiograms, which is just like an ultrasound of the heart. So I went in 3 times and got echoes while I was pregnant with Gilbert, and they didn't see anything wrong with his heart. It looked normal. The function looked normal. They weren't concerned. They saw like a little bit of backflow in his tricuspid valve, which is where your left ventricle, that area. But they said, this is common. Your baby is going to be fine. They're probably going to come out crying, acting normal. And if you want to get a follow-up echo after he's born, then, if you need to, you can do it, but he'll be fine. So then fast forward to Christmas Eve, we had Gilbert. He was born at the hospital. Everything seemed fine, but within like a few minutes of his birth, they were like, he's kind of cold. He's not maintaining his temperature. So they wrapped him up and swaddled him a bunch and then put him under the heat lamps. And then they were like, okay, he's good. We had a pretty quiet first night. The next morning, Christmas morning, the girls were with their grandparents. So they brought them over to visit. They got to hold Gilbert, and that was the last time they really got to see him until like January, because shortly after that, Christmas night, Andy and I settled in with our room service meal. We turned Dune 2 on. We were like, all right, tonight's going to be like the cluster feeding night. But he still wasn't maintaining temperature, and a nurse came back to check, and she was like, this isn't right. They took him under the heat lamps again. They checked his glucose, and it was super low. It was 11, which I had no idea what any of that meant at the time. But what I did know was like my worst nightmare was starting to come true, because in the back of my mind was my brother Ben. Like, okay, so, like something is happening. So we were admitted to the NICU. We stayed at the NICU at our hospital for 3 days. They did the echocardiogram follow up, and they saw that his heart function was severely diminished. Like, his left ventricle was severe. His right ventricle was, I think, moderate, but basically your left ventricle pumps the blood out to the rest of your body. And so he was in heart failure. And so they airlifted him to our local children's hospital. And then we were there for 80 days. So Gilbert was hospitalized for a total of 84 days, starting from when he was born. Um, yeah, so it was a, terrifying, like total roller coaster. Yeah, it was the hardest thing we've ever been through up to this point. Um, we we got his diagnosis. So it's called left ventricular noncompaction. We got that diagnosis within a day of being at Children's. Then we got his Barr syndrome diagnosis. It took a little bit longer because they had to do a genetic panel. So we got that when he was about 2 weeks old. And our doctor, which we just like, there are some things, where you just feel like whatever in the universe, like whatever you believe, like we are so grateful for our cardiologist, because she actually is one of the people who testified at the AdCom for Elamipretide. So she knew all about Elamipretide. And she knew about expanded access. She was able to get us expanded access. She was so funny. She was like, "Well, we asked for it tomorrow, but they've got to do some red tape and go through some things." So we finally got access to it when he was. We started it when he was 28 days old, and he's been on Elamipretide ever since.
Wow.
The crazy thing about Elamipretide and just like the way that it has changed his life and our life is he was on continuous IV medication. He was on milrinone, which you can only have through an IV. You have to be hospitalized to have it. He had a central line. He had to get those lines replaced. Like, it's such a nightmare to have a central line. And he was on those medications, and even with that, like, he was having such a hard time feeding. I mean, he could barely eat. Like, it would take an hour for him to eat like 20 milliliters. I mean, a milliliter a minute. It took so long. He would fall asleep. Like, he was not gaining weight. When he started Elamipretide, within a week, he started to be able to increasing his feed volume. And we were discharged. Like, he got his, I think he got his line out, like, it was like a month or two after being on Elamipretide. Then we switched to subcutaneous. And then we went home. And then since then, he's just been able to continue gaining weight, has the energy. I mean, he like does not look like he has a heart problem. Like, this is a chunky, happy, healthy baby. Like, he plays normally. He does everything. Like, he's hitting developmental milestones that boys with Barr syndrome don't typically hit. He is just like living proof of the miracle that Elamipretide is. It is like done so much for him, and we just, like, as parents, to see him going from near death to being able to survive and thrive like he is now has been amazing. So it's been a long journey, and now, I think the next hurdle is making sure he can stay on this medicine.
Yeah. And I think, we've been on some calls, the past month together. And I think one of the things that you had said was, when he was first born, before he got on Elamipretide, people always were like, he's such a good baby. He doesn't ever make any noise or anything. And you had said something like, well, no, that's not good. Like, they're supposed to cry and, do all these things. And you said after getting on Elamipretide, he was doing all of those things, what a typical, baby is supposed to do.
Yeah. Yeah, I mean, when he was born, he cried like a little lamb. Like, just, he was so quiet, and we were like, "Oh, it's so cute." But like, now we know that was a sign that he was not doing okay.
Yeah.
And yeah, I mean, once he was on Elamipretide and he was starting to improve, like, his personality came out. Like, he had so much more energy. He was awake more. Like, I mean, he's such a happy baby, and he's so silly. Like, he laughs at everything. Like, his favorite thing in the hospital was like this mobile he had, and he was like obsessed with it. Like, And then since being home, I mean, the other thing too is like he went from just being able to like bottle feed to then breastfeeding. Like he transitioned to breastfeeding, which like his cardiologist was like eating in general, bottle fed, breastfed, whatever. Eating takes a lot of energy. So for him to be able to do that is also pretty incredible because he just had no energy. He could not. And I mean, we know Barth syndrome is a mitochondrial disease, and you need your mitochondria to be able to do everything.
Yep.
So yeah,
Yep.
it's a real testament to the power of Elamipretide.
Yep.
Oh, that's awesome. Well, we're so thankful for Elamipretide, and I mean, I just can't wait to meet Gilbert in person. He just
Yeah.
seems like such a sweet little happy buddy, and what a cutie too. I'm gonna go over to Caro now. Caroline, if you want to tell a little bit about Hope's story and, Elamipretide and kind of, where y'all are at now. And then we'll kind of weave in, where both of how all of our stories kind of came together and where we are now as far as the FDA goes. What else we need help with from all of our friends and family and community. And I've got some other questions for you guys.
Yeah. So, I'm Caroline, and Ben and I, we have 3 kids. We have Thomas, Hope, and Lily. Our sweet Lily's our caboose who made her way a few months ago. And so, Hope was born with MLS syndrome, and so that's microthomia with linear skin defect syndrome. And so it is, if you talk about mitochondrial disease, it's under the umbrella of a mitochondrial disease, like as is Barth syndrome. So it impacts her mitochondria. And so your mitochondria, if you don't know, I didn't know this. I didn't pick this up from my, I guess, science classes in high school and college, but it's the powerhouse of your cell. So over like 90% of your cellular energy like comes from your mitochondria. And so you really need your mitochondria and strong mitochondria to really thrive. And so Hope was born with MLS syndrome, so it's caused her to be deafblind, and she has 2 heart conditions and a brain condition. And so early on we understood that the most severe thing we were facing with Hope was her heart condition. So Hope has cardiomyopathy. That's one of her 2 heart conditions. And cardiomyopathy is the leading cause of heart transplants in infants. And so it is a very severe heart condition, and something that was stable for a while with Hope, where her ejection fraction, that's kind of what they used to measure heart function, was reading slightly below normal until February of 2024. So kind of our road to Elamipretide started in February of 2024 when Hope's heart function started to decline. Thankfully, Hope's genetic doctor from Emory, he knew enough about mitochondrial disease to early on say, hey, I'm not an expert in mitochondrial disease, but MLS syndrome is under the umbrella of a mitochondrial disease. And they specialize in this at Children's Hospital of Philadelphia. And so he referred us up there to CHOP. And so we started visiting with them twice a year with Dr. Falk and Dr. Goldstein. And so at one of Hope's visits when she was 2, I remember they said to me, hey, her heart function right now is stable, but if that changes and if it starts to decline, then let us know, because we have a drug that we are using with other kids with mitochondrial disease. It's in clinical trial right now. It's in phase 3, and we've seen a lot of success, so much success that there have been children that have been on the heart transplant list that have started Elamipretide, and they've approved function enough to come off the list. It's a targeted therapy drug, and it can remodel the heart. And so I remembered kind of tucking that away in my mind. And so February of 2024, February of last year, when her heart function declined, it declined 14 percentage points. And we suspected it was declining. Hope had started sleeping a lot. She was sleeping till sometimes 2 o'clock in the afternoon. And so we suspected that something was going on with her. And so, we thought it was probably her heart. And so sure enough, we went and we had an echo done, and we found out that her heart function was declining. And so I remembered what her doctors at CHOP had said about Elamipretide. So as soon as, we got the results of that echo that her function was on the decline, I reached out to Dr. Falk, Dr. Goldstein, and so within a week we were able to get on Elamipretide through the expanded access through emergency use. And so we started Elamipretide, and her heart function has stabilized. So whereas we were concerned that the progression of cardiomyopathy would continue and her heart function would continue to decline after it made that initial 14 percentage point drop. We started Elamipretide, and it has maintained there since.
Oh, I think she froze for a minute. I think she was going to say that her heart function has remained stable, which it has, which is great. I think one of the other things to add, and when Caroline comes back, we can let her finish, but Madison, make sure I'm saying this right, but Barr syndrome, it only is a syndrome that can happen in males. And from what I know, there are only 150 known cases of Barr syndrome in the United States, right?
Yeah. So it primarily affects males because it's an X-linked genetic condition. So, what we did figure out through all of this is that my brother did have Barr syndrome, and it does not. Right now, the mutations don't affect girls. There aren't really, I don't think, any known cases of girls, but it's not this. This mutation is kind of crazy because there's so many different types of the mutation on the gene. So every specific case of Barr syndrome is a little bit different. It
Oh,
manifests
wow.
differently, but they all share specific characteristics. So cardiomyopathy is one of the main ones. Neutropenia, which is low white blood cell count. Just like overall fatigue, skeletal myopathy, which is just like how your muscle cells, also the mitochondria are affected. So yeah, there's it's primarily in boys though, because like Caroline was saying, back to science class, right? You have boys that have X and Y, or X and Y, and girls have an XX. So if you have a mutated X, uh, you have a mutated X gene, well, chromosome, whatever it is.
Yeah.
I got to get my words right, but if
You
you're a
didn't
girl,
know that you were going to be a mom and have to be
right?
get your PhD as a doctor too in
Yeah.
about 28 days, right?
Yeah. But you inherit your mitochondrial DNA from your mom. And so if you're a girl, you have two X's because you get one from your mom and one from your dad. And so even if you have that mutated X, you would not present as symptomatic as a girl. You would, however, be a carrier for Barth syndrome. And so this is, in families, it can go for years undetected, potentially, because what happens is if you're a girl, you've got a chance that you could be a carrier. If you are a carrier and you have a boy, he has a 50% chance of inheriting the mutated gene, because you get your X from your mom and then you get the Y from your dad. And so for Gilbert, he had a 50-50 chance, and turns out he got the mutated X. So
Yeah.
Yeah.
um, yeah, so it's primarily affects boys, but I know, Caroline, isn't MLS syndrome primarily girls?
Yeah, and
Yes.
Carolyn, that's what I was gonna say to you. Hope, like if you can speak on how rare Hope syndrome is as well. I believe it only affects 100 in the entire world, and it's lethal in males.
Yeah. And sorry, I got cut off. My phone actually overheated, so it kicked me off. But we're very good at technology around here. But yeah, but anyway, I was just kind of explaining before I got kicked off just how wonderful Elamipretide has been, and how it's really been a gift to have Hope on it, and give us time with her and allow her heart to stabilize, and just enjoy her sassy little self. But yeah, MLS syndrome, it is lethal in males. So it impacts a gene in your X. And since girls have two X's, one of hers is healthy and one is not. And so that's how girls can live with MLS syndrome. And so I've read different literature, and so it's kind of hard to know. Some literature I've read says there's 64 reported cases in the world. Some says up to 100. So I just kind of chalk it up to, hope is a unicorn, and it's lethal in males, and there's 100 girls or less that are living with MLS syndrome in the world.
Mm. So, and that's, I think one of the neat things is, it stinks how we've all sort of come together in this fight right now. That we have these unicorn babies in our lives, basically. I consider Gilbert part of the unicorn club too,
Yeah.
The male unicorn, and then we got Hopi, the girl unicorn over
Yeah.
here. But I think one of the things, some people have asked is, what is Elamipretide and how do you give it to Gilbert and Hope? Do one of you guys want to, tell people and explain, like, how do you give it to Gilbert and Hope every day?
Yeah. So Elamipretide, it's administered through a shot. And so we give Hope a shot every evening. I believe that I understand it to be a weight-based shot. And so kind of based on your weight, that's how much dosage you get. And so, we give her a shot. The safety profile of Elamipretide is pretty stellar. And so really the only safety thing that is a concern is injection site reaction. So whenever you're giving a shot, sometimes you might get some raised skin and it might turn red. And so we have had to put some Benadryl on Hope from time to time if, she has a reaction to the way that we administer the shot every evening. But overall, it is a very safe drug. And so that's how it's administered for us.
Yeah, and it comes in like a little vial, and it's compounded based on, like Carolyn was saying, like I think your weight.
Yeah.
And yeah, it's like you just draw it up. It's a little subcutaneous shot, so meaning it's not like a big, huge needle for like an intramuscular shot. It's just this little needle. And yeah, we give Gilbert his like in the late afternoon. It's like really, I mean, it's not a big deal. Like, it's a quick little shot. He cries for a second. You pick him up, he's fine.
He's
Like,
fine. Yep.
Yeah.
That's how
he
Hope
does
is.
not.
She's
Yeah, I
used
mean,
to it now,
yeah. Well, and like
It's
the
part
thing
of
is,
her life.
yeah, it's like this is just normal, and also
Yeah.
like this is way better than the alternative of like
Yep.
being hospitalized and waiting for a heart transplant, because
Yeah.
that's kind of what we're staring down if we don't have Elamipretide. Because we had a meeting with our cardiologist, and she kind of confirmed that that's what we were thinking, and she was like, yeah, no, like if his heart function declines enough, it means that you're back in the ICU, you're back with a line, you're back on milrinone, and you're waiting for a transplant, you're waiting for an organ. And there are kids who have died in our Barth
Yeah.
syndrome community waiting for hearts.
Yep.
And heart transplant, there's so many other things that go on with that, like
Yeah. There's
yeah,
rejection, and you have a lifetime of medications you're taking, and it's not easy to find a match. And then the other kind of really awful thing to think about is, like, if you're trying to get an organ for your kid, it means that another kid has died.
yeah,
And so you're taking an organ from a family that lost a child,
yeah,
and that's hard. And so anytime you can allow a child to keep their native heart, that is a win.
mm-hmm.
And Elamipretide is doing that for children. And so that is what y'all are helping us do. This whole community that's kind of gotten behind us and helped us advocate for this drug, that's what we're doing.
We've been fighting, the process within the FDA, but if there is no Elamipretide, what's going to happen? Like, what happens? What's the game plan with Gilbert and with Hope? Matt, have y'all talked to your team about that? I know that's kind of like a twist, and we're going to come out of this in a minute, but I want, people to know like how serious this is. If there's no Elamipretide, our Gilbert and Hope gonna have to go on transplant lists? And is that like where we go next, or is it kind of unknown?
Yeah, I mean, it's kind of both. I mean, I think our assumption is that his heart function was very severe. I mean, his ejection fraction improved enough for him to come home. Like, it's, you know, we've been monitoring it in the time since he started the drug. And the thing about Elamipretide is it can sometimes take a little while for you to see like any major results. But I mean, honestly, like, clinically looking at him and just seeing him and the way he is now, like, this is a baby that is doing really well. So we have cardiology appointments every like 2 months now. So we're like, the timing was so frustrating because we had an appointment on May 28th, and then the next day, May 29th, is when we found out about the denial. And so it was just really hard because it was like, well, we just had our appointment. We're not going back until July. So it was like, then we just started on this advocacy journey. So we haven't really had a chance to connect with our cardiologist yet, and talk about kind of what does it look like if we don't have this drug. Because the other thing too is like, it's like not an option. Like, we're not even going to go down that route because it's like, I know too well, and my family knows, and so many of the Barth family knows, like, we know what the world looks like without Elamipretide. We've already been living in that world. And to have this ability to have a treatment that's so effective and have that be taken away is just like cruel. And it's also just, to me, one of the hard things is, like, as a parent, when you have kids, you look at them and you're like, oh, you try to be present and savor every moment because you're like, okay, I got to be present. But then you're also like, I'm tired and like I need a break or whatever. But like with Gilbert, it's, to me, there's always this kind of like internal clock that's been ticking because of my brother. So like, to me, it's like, okay, well, Ben made it till 11 months. So are we doing a countdown right now? Because that's what scares me. Like, and it's, the other thing with Barr syndrome is it is such an unpredictable disease. There are boys, like, since joining the advocacy, like, journey, like, and getting to know some of the other stories, like, there are boys who have had these sudden cardiac events, and they're not on Elamipretide. Like, they haven't had access to it. And so you have this sudden cardiac event, and suddenly you're getting a subcutaneous defibrillator, which is, it's implanted in your body so that it can shock your heart and keep you alive when your heart stops working. I mean, like, that's what we're looking at. It's just like complete uncertainty, really, because with Barth syndrome, it's like it could be anything. Like, Gilbert could get a bacterial infection and that could kill him. Like, when you have neutropenia, your body can't fight infections the same way that everybody else's does. So like, Elamipretide offers some stability, and we're not going to have that. We are going to be exactly where everybody else is who's not on it right now, which
is no treatment option.
Yeah.
Yeah. And that's the thing is, I mean, if Elamipretide is approved, this would be the first FDA approved drug for mitochondrial disease. And that's a big deal. Mitochondrial disease goes beyond MLS syndrome and Barth syndrome. And so, there's a lot of kids out there that are eager for a treatment. And here's a treatment that it's safe and it's effective. And so it really is something that should be approved. I haven't gone as far as, I'm kind of with you. Like, I'm not going to the place where I'm like, oh no, this is not going to work out and not get approved. Like, I need to look for an alternative. Like, in my mind, I'm like, this is going to get approved. Like, this is going to work out. Like, we're going to win here, because it's the right thing to do. And I always just think if you pursue the right thing, like, you're going to come out on top. And so, I don't know if there is any other treatment options in development, none that I'm aware of that would be on an alternative for Hope to take if, this is no longer an option for her. And so, we're going to keep pursuing this as if, this is going to work out and this is going to be an option for all these kids.
Yeah. And I would add too that, Elamipretide been in development since 2014. So 11 years at this point. And in that time, and the time that's just taken to develop the drug and do the trials and go through all the hoops that the FDA has created, and 10% of the Barth community has died. And like, I mean, that's the reality, is like, kids will die.
Yep.
So,
And that's so true. And kind of like broader, also as far as, rare disease, and this is not just rare disease, this is ultra rare disease, but less than 5% of FDA approved drugs are for the rare disease community, and here's a drug that it is safe and it is effective, and we're going through these hoops, trying to help advocate for approval for these kids to live.
Yeah.
Um, yeah.
Well, and that let's talk about that a little bit. So, 5% is approved for ultra rare disease. Let's go to the AdCom that happened at the end of 2024. We had Madison, did you go to that actually? Had y'all met
Were
before
you?
at that?
I don't remember seeing you there, but like I don't know because I was only there a few hours, so maybe you were there and I missed you.
no, because Gilbert wasn't born. So he was,
Oh, yeah, because
Oh
he was,
yeah, okay.
yeah,
Madison
so,
was on no fly.
That's right. Okay, you were grounded.
yeah,
And you didn't
um,
even know really at that time, kind of,
yeah.
yeah, what was going on. So yeah, the AdCom committee meeting, that was in October of last year. And so me and my sister Anna and my husband Ben and my son Thomas, who's our baby advocate, we all went. And so we also had friends and family submit letters, to the FDA to review in preparation for this meeting to kind of consume from the patient standpoint of why is Elamipretide important to these patients and to these kids, and how is it helping them? And so we actually went and we sat through that meeting, and so we got to hear kind of the back and forth between the FDA, this advisory committee, and Stealth, who manufactures the drug. There was a 1 hour time frame where they had people testify orally. We submitted, written testimony supporting what we've seen in Hope and the benefits that she has seen from Elamipretide. But we got to hear people talk for an hour about how this drug has really transformed their life. And I just remember, sitting there, I just cried. I cried the whole time. I mean, I'm just sitting there, and I was pregnant with Lily, so I was like, had a lot of hormones going on.
extra
But
crying.
and I'm crying. And so, but yeah, and even Ben, me and Ben and Anna and Thomas, he's so sweet. He was kind of playing a game, so he wasn't really, as engaged as we were, but we all were just crying, hearing these stories, and also really empathizing with, like, we've seen this in our own child. And so it was really impactful. And so coming out of that meeting, this advisory committee meeting that met in October, they voted in a 10-6 vote in favor of approval for Elamipretide. And so what we have since learned from that meeting is that when drugs come out of that meeting in favor, then 97% of the time they get approved. So here we are with this drug for an ultra rare condition with no other treatment options, that's in 3% of drugs, that was not approved, based on the recommendation from this committee. So, that's tough.
Yeah, and I think I want to add too, I've got some other questions for you guys, but one of the things that I think a lot of people have been asking is, oh, this is political, it's the administration, it's not the administration, y'all. It has nothing to do with Trump. It has nothing to do with Biden. I just want to tell y'all this. Congress passed the Orphan Drug Act in 1983. 1983. I was not even born yet. Kieran wasn't born yet. Madison, I doubt you were even born yet. None of us were even born yet. And it's to incentivize rare disease drug development. And what it includes is faster review times. And it does encourage the FDA to be flexible in its review process for rare disease therapies. And this flexibility is often exercised through the acceptance of smaller, less rigorous clinical trials and reliance on other forms of evidence to demonstrate a drug's effectiveness, which this goes back to the AdCom. This is an ultra rare disease. The clinical trials were in Barth syndrome patients, and 10% of Barth syndrome patients in the United States, there's only 150 known Barth syndrome patients. 10% were on the trial for Elamipretide. And I mean, all of the people and the patients who went and spoke at the AdCom, I mean, this 100% the Orphan Drug Act. I mean, it should have passed with flying colors.
Yeah.
And the only side effect was, Caroline and Madison, what you both spoke about was the site irritation.
Yep.
That was the only side effect of Elamipretide that was noted in any of the trials. So that's why this is so shocking to, I think, all of our families, all the other patients, but also friends and community members who are reading and hearing this and not understanding. You know, it just seems really crazy.
Mm-hmm. Yeah. Yeah. Everyone I talk to is like, why hasn't it been approved? It doesn't make sense.
Yeah, it
And
doesn't.
we're saying the same thing. We're like, no one, like, we do not understand why, because, you know, we watched, like, Andy and I watched the AdCom. I mean, it's an 8 hour, they live stream
Yes.
it, like, and it's up on YouTube, and like,
Yep.
you know, the patient testimony is incredible. And
Yeah.
it's just, I mean, they had a positive vote. It just does not make sense. And we've been trying to educate ourselves as much as possible since getting Gilbert's diagnosis. And it's like, this is just, it's nonsensical at this point. Like, I don't know why we're withholding treatment from children and young men and like girls and everybody. I mean, everyone can stand to benefit from this.
Yeah, and that's what is so frustrating, because, this Orphan Drug Act has passed, Congress, passed this, and the FDA has the flexibility. Everything's there. So there has to be a process issue here, which is, let's talk about where are we now? What are we doing? And how do we need people to help right now? So, one of the things our Georgia delegation did is we got Congress to send a letter to Commissioner McCary, basically asking, hey, why was Elamipretide, denied? We don't understand. We would like an explanation of the why. And it was a bipartisan letter. All the delegates signed on, and we didn't really get the response we wanted. We got a response back from them, which was it was like a non-response, basically. But we really appreciated the delegates of Georgia standing up for the rare disease community and letting the FDA know, like, hey, we're standing behind these ultra rare disease, patients in Georgia, but especially in the nation. I know that Mississippi, Tennessee, they're working on some stuff. I know, we've been working on Florida. I've heard that, Representative Kamek and Representative Dunn, I believe, have committed to sending a letter, and I'm hoping that Florida is gonna get one going. Madison, how's everything going out in Colorado with you guys?
Yeah, we're also working on getting a letter. We've, it's taken a little bit to get meetings. We finally started getting some traction. We've met with both Senator Bennett's office and Senator Hickenlooper's office. We've met with Representative Dinah DeGette, Representative. We're going to be meeting with Representative Jason Crow next week. So we are, we've given them like all the information we presented here. They've all been very like sympathetic and understanding. And so we are trying to get a delegation letter as well. So, right now, we have our meeting next week with Representative Crow. No one has yet like fully committed to leading the letter. Everyone has kind of said like, yeah, what are the questions you want? Or like, what are some of the things you want us to say in it? But we haven't had anyone say firmly yet, like, yeah, I'm taking the lead on this. So we need somebody to step up and decide to take the lead. So we're going to give Representative Crow's office a chance to meet with us and talk with us. And then, I've reached out to all of the representatives in Colorado. These are just the ones that, like the district I live in and the district my parents live in. But, this is going to, we want it to be bipartisan, because this affects everybody. Like, this is like, it can have really great bipartisan support, because rare disease doesn't pick and choose. It can affect anybody. So.
Yeah,
That's so
very
true.
true. And I think that's, at the end of the day, like, this is not any party issue. This is just a right and a wrong thing, and it's the right thing, for our elected officials to step up and to support the ultra rare disease community.
Mm-hmm.
So do one of you guys want to talk about the meeting between Stealth and the FDA and kind of what came out of there?
Yeah, go
Yeah,
ahead,
go
Karen.
ahead, Madison. No, you
Yep.
go. Yeah.
Or y'all can tag team it.
Okay, what's that?
Yeah,
So
because I think a lot of people are wondering, like, okay, where are we now? Like,
Yes, and I think that's
yeah,
the big question is like, okay, where are we now? Like, what's happening?
yeah,
And I don't think a lot of people know too, the news about what Stealth did, that we can also talk about. And I think we just need to talk about too, like how people can help. So I'm going to let you guys let the cat out of the bag and, yeah.
yeah, so the exciting update is that Stealth and the FDA, Stealth has submitted a request for reconsideration to the FDA. So reconsideration of the negative decision is in front of the FDA now from Stealth. And it's our understanding that Stealth submitted this the first week of July, and so they're expecting a decision by August 1st. It's also our understanding that the FDA does not need any more data around efficacy or safety for Elamipretide. So at this point, the message is clear from us: reverse the decision,
mm-hmm.
approve Elamipretide now for all
Yes,
ages.
For all ages.
Yep.
all ages.
Yeah. And I mean, the clock is ticking. I think one of the things that is on our mind too is that Stealth is a small company. They've invested years and years of their time and resources and energy into this drug. And they just don't have the runway to keep going, to keep having to resubmit, to have like one committee to go from this place to this place. I mean, they have been juggled around at the FDA. And so we have been told, if we can't get this drug approved soon, Stealth only has 6 to 9 months left of runway. And
Yep.
that was on May 29th. So
And just so folks know, when the denial of Elamipretide happened, Stealth cut 33% of their workforce just to continue making Elamipretide for the next 6 months.
Mm-hmm. Yeah, I mean, if we're not able to get this approved, Stealth, it has the patent on the compound. Like
Yep.
Elamipretide goes away. Like we don't have other
If they
options.
don't make it, nobody makes it. Yeah.
Yeah.
So
Yep.
we need a reversal, and so we need to push that because we don't have time. Like we don't.
Mm-hmm.
We have probably now 5 to 8 months, if that. I mean, this the FDA too has taken. I mean, even the decision around Elamipretide that we got on May 29th, that was a month late. They were supposed to tell us on April 29th. And for no reason, they waited a full month. So, we're expecting a decision by August 1st, but who's to say that, they're going to actually honor that? So we need to put the pressure on and get the reversal and get that decision now.
Yeah.
Yep.
So now that everybody knows that, Stealth has submitted the request for the reversal of, reconsideration, we're expected to hear by August 1st, now what can we have people do? What's the game plan now? I know one of the big things is like media and keeping Gilbert and Hope in people's stories, keeping them in the media, keep sharing their stories and tagging, all these people so that, they are relevant. I know that is a terrible term to use, but we have to continue that fire and keep that going through, August 1.
Mm-hmm. Yeah, I mean, I just think August 1, make a big push till then, keep this top of mind. Don't let them forget about these ultra rare disease kids that are benefiting from this drug.
Yeah. And then I guess the other thing too is, should people still keep calling and emailing Congress and letting them know?
I think so, because I think, in my ideal world, I would like every representative and senator to know the word Elamipretide.
Yes. And this is how you say it, Elamipretide,
Yeah,
okay?
Yeah. It took me a while to figure that out.
yeah,
Yeah.
yeah.
No,
I mean, we like, and this is really, I mean, it's an ultra rare disease, but there are so many other ultra rare diseases that this is really kind of like a litmus test
Yeah.
for how, you know, are other drug developers going to want to take on ultra rare communities. I mean, if they are seeing that this is what happens to a company when they try to stand behind an ultra rare disease and try to develop a therapy, companies aren't going to want to do that because
No.
you're not going to recoup everything that you put into it. And so,
yeah.
um, yeah, it's, I mean, this is, I think it's huge. I think we want everybody to know it. Keep calling. I mean, persistence, like Haley, that's how you and Caroline, how you got your delegation letter. You all were so persistent. You just kept following up and kept following up. And that's what we started to have to do too. I mean, I email every day, like, hey there, just want to remind you, top of the list
Yeah.
here.
I mean, it's terrible. You have to just be the squeaky wheel. And
Yeah.
I have no shame in, sliding into all these, CNN and Fox and Friends and Anchors, DMs being like, hey, can you share Hope and Gilbert stories? Like, look what's happening. And, you don't hear back, but I'm just like, if I keep doing that, maybe they'll actually read it once and be like, God, this girl is so annoying. I'm going to respond back and just, and then maybe they'll be like, oh, wow, this is important.
Yeah, well, and I think the thing too that I'm just like also thinking about is that like Hope, like we are willing to be very public about this, like for Hope and Gilbert. There are like these are two kids, and they behind them, what we all don't see is all the other kids and all the other families and their communities who might not necessarily be ready or comfortable or able to
Mm-hmm.
share their stories in the same way we are, and so like Hope and Gilbert represent a whole community. I
Yeah.
mean, we've had lots of families speak out in the media, but there's so many more. I mean, there's 4 families in Colorado that have Barr syndrome. We've been, very vocal about it. I don't know those other families, but I know that they're going to benefit too. And
Yeah.
so, we're just like, I'm like, we got to put Gilbert out there because this is for everybody in this community.
Yes.
And even,
Yeah.
yeah,
And I know that's
And
got
it's
to be
not
really
easy.
hard on you guys as moms because, I know you're doing this, for not only your kids, but also for, a whole entire community of ultra rare disease. But having to be that vulnerable about something that's just so hard, I mean, that's got to be tough. Can y'all talk about that at all?
Yeah, I mean, that has kind of been my least favorite thing about all of this. Obviously, it just feels like, it feels like just being so vulnerable, and it feels cringy, and you hate it. But the alternative is you don't get this drug approved, your kid can't benefit from it, and they could die. And
mm-hmm,
so it's like, yeah, I'll get out of my comfort zone for that any day. Yeah.
yeah,
But it's no fun. And I don't think it's something that a parent should have to do
Yeah.
no,
for a drug that is safe and effective.
yeah,
Yeah, and that should have been an easy yes. And I think our dad in our family text, he had read, an article, and he said there is no good reason to not approve Elamipretide. And he is so right. There's not any good reason why Elamipretide should not be approved.
yeah, it's true. And it's, yeah, to your point, Caroline, like, it's just, it's uncomfortable to have to do this. I mean, I was not planning on like sharing Gilbert's diagnosis with everybody. I was just planning on like, yeah, let's like, we just got out of a traumatic 84 days in the hospital. Let's just lay low for a little bit and like recoup and get
Yeah.
our family back together. I mean, what it does to your family, like being a rare disease parent, an ultra rare disease parent, and your children, and the conversations you have to have, that's hard
Mm,
enough. And then to have to like put yourself out in the public
yeah.
is
That's
it's really
hard.
challenging.
It's, yeah, I was telling someone the other day, because so we have a newborn, And I'm on maternity leave, which, like, my last maternity leave with Hope, you know, it was hard. We were at the doctor and we had like all these specialists, and like, you know, we were trying to figure out what was going on with her, and it was like not a very fun maternity leave. So we had Lily, and I was like, and everything was going well with Lily, and I was like, oh, this is gonna be so much fun of a maternity leave. I'm gonna like binge watch some shows, and I'm gonna like hang out with the kids and have a fun summer. And then all this hit, and I was like telling someone the other day, I said, yeah, like, you know, going up against the FDA was not something I had on my bingo card for my maternity leave
Yeah.
right now. So, you know,
Yes, that's like the same thing
Yeah.
I had too. I was like, did
yeah,
not think this was going to be our
nope.
situation.
Yeah, so maybe I should have a fourth kid, you know, maybe.
I know. I feel honestly like I mean, listen, 4 is going to be your number. You can binge watch all your shows.
Maybe, I don't know.
Yeah. But also,
But,
like, Carolyn, what you said too, of like, no parent should have to do this. Like, so I feel like, okay, we will do this. Like, we have got to do this because we don't have, like you said, we don't have a choice. Like, it is between our child's life and our child's death. Like, so we're
Yeah.
going to do this. But also, this should not be how it goes. Like in 2025, that we have to go through this just to get life-saving medication that is safe
Yeah.
and effective. Like, no more parents should have to go through this.
Yeah.
No.
but
Can
you know
something be
what, though?
easy?
You
Every day I'm
guys,
like, can something be easy, please?
but you know what, though? Y'all are both seriously doing an awesome job. Like, seriously, like, no one can do it better than the both of you guys. And y'all are killing it being, you know, parents of kids with ultra rare disease. I mean, that is so hard, but y'all are excelling at it. And I mean, just keep doing the best job, y'all. Seriously, y'all are inspiring. And I'm just, you know, glad to know you and get to be in your circle.
Well, same for you, Aunt Birdie. And you, Aunt Birdie has become the Aunt Birdie of like all the ultra rare disease kids. It's
Yes.
like Aunt Birdie's like the fairy godmother. And like she kind of swoops in and like gets the delegation letter done, and then she's off.
Just gonna get my wand out.
Yeah.
No, it was a team effort. Honestly, it was just our communities have just been amazing. And, you know, we could not do it without the support of our families, but more importantly, our communities. I mean, the rallying of, you know, the Warriors for Hope and Team Gilby. I mean, it's incredible. Like, it really shows that we're not alone. I think that ultra rare disease and, you know, any kind of trauma and hard stuff you go through, whether it's, you know, ultra rare disease, cancer diagnosis, I mean, anything that, you know, is not the norm, I think it can be isolating, and you a lot of the times can be like, no one else is going through this. But when you have so many people backing you and supporting you, you're like, wow, like I'm not walking this alone. Like everyone is surrounding me and for my kid, and that's awesome.
Oh yeah, that's been like the sweetest part of this is like just seeing how our communities come together, and people like friends that I have that I haven't talked to in years, and they've reached out and said, hey, I know so and so, or I have a connection here or there, that have been willing to put themselves out there and put their name on the line and help us bridge a connection that might can help, has been so sweet. And so when we finally get this approved, we
We're
want to
getting
throw a big
tattoos.
party in Hall County for everyone that helped Hope. If you prayed for Hope,
Okay, but listen, hear me out. When Elamipretide is approved, the 3 of us are getting tattoos, and we're inviting anybody else. If you want to come with us and get vial tattoos of Elamipretide, you're invited, okay?
oh man, I need another tattoo. So
Okay, well, y'all, thank y'all so much. So thanks for tuning in, everybody that stayed on here. I hope this helped kind of let everyone know where we are now. And, you know, we may do this again. Who knows? Maybe we're going to start a podcast. I don't know. Maybe maybe we're going to be those girls, you know, and get really techie and cool. So, all right, Callie's going to get tatted up with us.
yes,
all right, Callie. Yes,
Callie,
can
I think
see
you should get a mahjong tat. Get you
No,
a.
because she just destroys people in Mahjong. I'm still mad at her.
She
You
needs the
know,
Joker tile. Yeah, Callie.
she does. No, she needs the 9 bam. That's what she
Okay.
needs is the 9 bam tattoo.
Okay.
Okay.
I love it.
But we digress. Thank you, everyone, for your help. What you can do now to help is continue sharing Hope and Gilbert's stories, okay? Every single day, and tag the FDA, tag doctor. We have been tagging the wrong commissioner. We just found out. So we don't know if he just changed or started a new Instagram or something, but it's Dr. McCary. So
FDA.
Oh, so
FDA.
Yeah.
I've been tagging the wrong guy in the white coat.
Yeah, we all have. He has
Smarty. Oh.
78,000 followers, but who would have known that maybe that's his personal one.
Yeah.
I don't know.
Yeah.
So
No, I think it's his personal when he got his FDA one.
yeah, he's got his
Okay.
FDA one now. So we're following him, and we will be tagging the correct the accounts tonight after this. So tag all those people every single day. Basically just annoy them until they just basically have to say, fine, we will just approve this if you guys will stop. Okay. We're sick of Colorado. We're sick of Georgia. It's done, you know?
Yeah.
I see Aunt Lauren's on here. Thank you for your videos, Lauren. You know, I could never put those together.
Yes. And yeah, Lauren, if no one knows, Lauren Nunez, she is our social media director for Hope Filcheck. So we appreciate all of her reel making for Hope because none of us could have
Yeah.
done
They're so good.
that.
They really are.
Yes. But
Do you
all
do
right.
yours, Madison? I love everything you put
Yeah.
together. Do you do that?
Yes, I
Madison like does it all. She's like PhD in all the medical, you know, she is like the social media director, all the things.
I'm Gilbert's momager.
The momager
Yeah,
you are.
I love it.
That's awesome. Okay, well, y'all have a great night. Tune in next time for whatever this is that we're gonna call it. But yes, hopefully next time we'll have a better update that maybe is like, hey, we're going to get tattoos, meet us at the tattoo parlor
Yeah,
or something. So
maybe. I know, Madison, you've got a meeting Monday, and so like, yeah, maybe sometime next week we'll have some good traction, and we could hop on and give a little update.
yeah,
Yeah. Love
Yeah.
it.
yes,
All
perfect.
right.
All
Cool.
right, thanks for tuning in, y'all. Bye, Madison.
Bye,
Bye.
guys. Thanks,
Bye.
y'all. Bye.
Bye.